Mrcem Intermediate Neurology in Mock Test, question 31 to 50. Question 31. A 66 years old man suddenly develops right sided facial weakness, forehead square, and right arm weakness. The lesion is most likely located in A. Facial nerve, B. Left internal capsule, C. Right facial nerve, D. Neuromuscular junction, E. Cervical spinal cord. It's maybe left internal capsule, but let's see the answer. Yes, it's correct. Forehead sparing indicates an upper motor neuron facial palsy. The internal capsule contains descending corticobulbar and corticospinal fibers. Question 32. Which headache requires immediate neuroimaging even if the neurological examination is normal? A. Chronic tension headache. B. Thunderclap headache. C. Migraine with aura. D. Cluster headache. E. Sinus headache. It's cluster headache. No, it's thunderclap headache. B. Thunderclap headache is subarachnoid damage until proven otherwise. Question 33. The most sensitive imaging modality for detecting an acute ischemic stroke is in the first few hours is A. Skull X-ray, B. MRI with diffusion weighted imaging, C. CT angiography, D. Contrast CT, E. PET scan. So it's CT angiography, C. But let's see. Oh, sorry, it's D. DWI MRI detects acute cerebral ischemia earlier than CT. In the emergency setting, however, non-controlled CT is usually performed first to exclude the hemorrhage before new perfusion therapy. Question 34. A patient with bacterial meningitis receives dexamethasone. The primary purpose is to A. Reduce seizures, B. Reduce inflammatory neurological complications, C. Lower intracranial pressure directly, D. Prevent the hydrocephalus completely, E. Treat the cerebral edema only. So it's D. Reduce inflammatory neurological complications. Early dexamethasone reduces the inflammatory complications, particularly hearing loss and neurological sequelae. A patient becomes confused after a seizure. This is called A. Aura, B. Thoughts paralysis, C. Post-ictal state, D. Syncope, E. Delirium tremens. So it's post-ictal state, C. The post-ictal state is characterized by transient confusion, drowsiness, and fatigue following a seizure. Question 36. Which finding is the most suggestive of raised intracranial pressure? A. Bradycardia with hypertension, B. Fever, C. Tachycardia, D. Hypotension, E. Hyperglycemia. So I think it's hypotension. D, but let's see. Oh, sorry, A. Pushing response, hypertension, bradycardia, and irregular respiration indicates the raised intracranial pressure. Question 37. A patient has severe sudden vertigo with normal head impulse, direction change, nystagmus, and skew deviation. Which is the most likely diagnosis? A. Benign positional vertigo, B. Vestibular neuritis, C. Posterior cerebellar stroke, posterior circulation stroke, D. Meniere's disease, E. labyrinthitis. It's A. C. The hand examination strongly suggests the posterior circulation stroke. Central limbs. Question 38. Which electrolyte disturbance most commonly causes seizures in the emergency department? A. Mild hyperkalemia, B. Severe hyponatremia, C. Mild hypercalcemia, D. Hypermagnesemia, E. Hypernatremia. So it's D. Hyponatremia. Hyponatremia is the common cause of metabolic cause of seizures. Question 39. A patient develops weakness after a tick bite. Reflexes are absent. The diagnosis is A. Botulism, B. Guillain-Barré syndrome, Guillain-Barré syndrome, C. Tick paralysis, D. Myasthenia gravis, E. Multiple sclerosis. So it's maybe tick paralysis. Yes, correct. Tick paralysis causes rapidly progressing ascending weakness that improves after the removal of the tick. Question 40. A patient has recurrent episodes of unilateral headache. Usually associated with tearing in nasal condition. Diagnosis: A. Migraine, B. Cluster headache, C. Tension headache, D. Trigeminal neuralgia, E. Temporal arthritis. So it may be, so it is migraine, but let's see. Cluster headache. Cluster headache presents with severe unilateral orbital pain in ipsilateral autonomic symptoms. Question 41. A patient with Question 41. A patient with suspected myasthenia crisis has an FVC of 12 ml per kg. The next priority is A. Oral pyridostigmine only, B. Immediate airway assessment and ICU admission, C. CT brain, D. Lumbar puncture, E. MRI spine. So it is B. Immediate airway assessment and ICU admission. FVC less than 15 to 20 ml per kg suggests impending respiratory failure, requires ICU and possible ventilatory support. Question 42. The earliest CT findings of acute cerebral infarction is A. Midline shift, B. Hyperdense MCA sign, C. Ring enhancement, D. Calcification, E. Hydrocephalus. So I think it's A. Midline shift, but let's see. Oh, sorry, it's B. A hyperdense MCA signs represents the acute thrombus and may be visible before established infarct. Question 43. Which cranial nerve is responsible for corneal reflex efferent limb? A. Cranial nerve 2, B. Cranial nerve 3, C. Cranial nerve 6, D. Cranial nerve 7, E. Cranial nerve 10. It's 5-1. C. Explanation: the ophthalmic division of the trigeminal nerve is the afferent limb. The facial nerve is the efferent limb. Question 44. A patient develops bilateral fixed pupil, dilated pupils following the head trauma. These findings most strongly suggest A. Migraine, B. Temporal arteritis, C. Severe brain herniation, D. Peripheral neuropathy, E. Bell's palsy. It may be severe brain herniation, C, but let's see. Okay, it's correct. Bilateral fixed dilated pupils indicate severe brainstem compression and a very poor neurological prognosis. Question 45. Which feature is the most characteristics of subdural hematoma? A. Lucid interval, B. Slowly progressive neurological deterioration after minor trauma, C. Sudden collapse during exercise, D. Thunderclap headache, E. Neck stiffness. So it's B. Subdural hematoma often occurs in elderly patients or those on anticoagulants with the gradual symptom progression. Question 46. A patient has ipsilateral facial paralysis, inability to close the eye, and loss of forehead movements. Diagnosis: A. Stroke, B. Bell's palsy, C. Internal capsule infarct, D. Multiple sclerosis, E. Parkinson's disease. It is Bell's palsy, but let's see. Yes, correct. Lower motor neuron facial palsy affects the entire side of the face, including the forehead. Question 47. The first line long-term treatment for trigeminal neuralgia is A. Gabapentin, B. Carbamazepine, C. Diazepam, D. Amitriptyline, E. Levetiracetam. I think it's B, but let's see the answer. Yes, correct. Carbamazepine is the recommended first-line medication for the classical trigeminal neuralgia. Question 48. Which artery is commonly involved in lateral medullary Wallenberg syndrome? A. ACA, B. MCA, C. PICA, D. Posterior cerebral artery, E. Anterior spinal artery. So it's, I think, anterior spinal artery, but let's see the answer. Oh, it's C. Posterior inferior cerebral artery causes the lateral medullary syndrome. It's C. Question 49. A patient presents with the fever, headache, confusion, and temporal lobe abnormalities. On imaging, the most likely diagnosis is A. Bacterial meningitis, B. Herpes simplex encephalitis, C. Migraine, D. Brain metastasis, E. Multiple sclerosis. It is bacterial meningitis, but let's see the answer. Yes, it's HSV encephalitis. Herpes simplex encephalitis classically affects the temporal lobes and requires urgent IV cyclovir. So it is B, HSV encephalitis. Question 50. Which of the following neurological emergencies requires immediate IV acyclovir even before the confirmation? A. Migraine. B. Bell's palsy. C. HSV encephalitis. D. Trigeminal neuralgia. E. Tension headache. So it's C, HSV encephalitis. Let's see the answer and explanation. So delaying antiviral treatment is suspected. The HSV encephalitis increases the mortality and worsen the neurological outcomes. Start IV acyclovir as soon as possible. Final high yield Mrcem neurology revision stroke. Use the NIHS, perform urgent non-CT and assess the eligibility for thrombolysis or thrombectomy. Status epilepticus, benzodiazepine, then second line anti-seizures medications, then anesthetic agents if refractory. Bullion-Bayer syndrome, monitor the FVC closely. Respiratory failure can develop rapidly. Myasthenia crisis, FVC less than 15 to 20 ml per kg, warrants ICU assessment and airway planning. Thunderclap headache excludes subarachnoid hemorrhage with CT, followed by lumbar puncture if indicated. Posterior circulation stroke, consider the hints examination in patient with acute vestibular syndrome. Bell's palsy, entire side of the face affected, including the forehead. Upper motor neuron palsy, facial palsy. Forehead is spared due to bilateral cortical innervation. HSV encephalitis. Think of fever, confusion, seizures, and temporal lobe involvement. Start IV acyclovir immediately. Raised intracranial pressure. Recognize pushing triad. Hypertension, bradycardia, irregular respirations, and manage urgently. Thank you.